First on our list is CPR for heart attacks. Time is of the essence, so stay calm and act quickly. Dial emergency services, then start chest compressions. Place the heel of your hand in the center of the chest and push hard and fast. Do 30 compressions, then give 2 rescue breaths. Repeat this cycle until help arrives.
So remember, 30 chest compression and to rescue breath. Do till medical help arrive.
Next, let's discuss burns. Cool the burn under cold running water for 10 minutes. Cover it with a sterile dressing. Never use ice, creams, or adhesive bandages directly on the burn.
So remember, remove the clothing and jewelry. Then cool the burn under running tap water and cover with sterile dressing.
Bleeding is another common issue in emergencies. Apply firm pressure with a clean cloth and elevate the wound. If the bleeding doesn't stop, apply a bandage and continue to apply pressure.
So remember, apply pressure on the wound to stop bleeding. And elevate.
Choking can be a terrifying experience. Stay calm and perform the Heimlich maneuver. Stand behind the person and place your fist just above their navel. Grasp your fist with the other hand and perform quick upward thrusts until the obstruction is clear.
So remember, 5 abdominal thrust and 5 black blows. Till blockage clear.
Sprains often occur during physical activities. Rest, ice, compress, and elevate the sprain. Avoid putting weight on the injury and seek medical attention as soon as possible.
So remember, rest, ice, compression and elevate.
Bee stings can be painful. Remove the stinger with a credit card, never squeeze it out. Wash the area with soap and water, then apply a cold pack to reduce swelling.
So remember, remove the stinger, apply cool compression, and elevate the area.
Allergic reactions can be life-threatening. If someone is experiencing anaphylaxis, administer an EpiPen if available and call for emergency help immediately.
So remember, inject EpiPen immediately if available. And call for emergency.
Snake bites can be deadly. Keep the victim calm and still and seek medical help immediately. Do not try to suck out the venom or apply a tourniquet.
So remember, calm down the victim, immobilize the affected part, and seek immediate medical attention.
Seizures can be scary to witness. Keep the person safe from injury. Do not restrain them or put anything in their mouth. Once the seizure stops, place them on their side and call for medical help.
So remember, stay calm. Remove harmful objects away from the victim, cushion the head, and note the seizure time.
Electric shocks can cause serious injury. Do not touch the person until you're sure the source of electricity is turned off. Once safe, start CPR if necessary, and call for medical help.
So remember, don't touch the victim till shut off power. Then do CPR if need, and seek medical attention.
Lastly, in case of a stroke, remember the acronym FAST. Face drooping, arm weakness, speech difficulty. It's time to call emergency services.
So remember, recognize a stroke via face drooping, arm weakness, speech difficulty and immediately seek medical attention.
In conclusion, knowing basic first aid procedures can be life-saving. Remember, in all situations, stay calm, act quickly, and call for professional medical help. Your knowledge and actions could be the difference between life and death.